only because of the Affordable Care Act that I was able to get insurance that I can live with. I mean, there was no way before. My health insurance before was at like $750 and it was going up to almost $1,000 a month. If Trump Care were to be passed, I would have absolutely nothing. I would be out. I would not be able to even afford the medication I'm on. To be honest, I've actually considered moving to Canada just so I could get health care if this passes. This is my country. I don't want to leave.
When Semele was born, there were major complications, life-threatening complications for both me and for her. And if we had not had excellent coverage at the time, there is an excellent chance that one or both of us would not have survived the birth. And we had that coverage through the ACA. So the ACA saved both of our lives.
Specifically the Medicaid expansion. In addition to the complications in delivery and immediately afterwards, because of physical complications that she experienced, she ended up having a year and a half of physical therapy. It was also covered by our insurance. Insurance that we have acquired under Covered California. And so if all of that, if none of that had happened, I mean, in the first place, either Crystal or Semele probably would not have lived through the birth, to be honest. Even if they had, it would have ruined us financially for the rest of our lives.
So just very concerned about, healthcare and what's going to happen with, pre-existing conditions like, pregnancy. I just had a baby, and, if we were to have more children, be concerned about how that would affect us, because the healthcare we did have when I had him was really good, and, it really helped make it affordable. But in the future, if, we're cut off or that's considered a pre-existing condition, I don't know how that's going to, how it'll affect our finances.
If Trump Care goes through, I don't know what I'm going to do, because I don't have any kids, and I don't want any kids for the next couple of years until I have a steady job. And sorry, I'm about to cry. It's hard to think about a place where I'm not valued as a woman, as a person, and that's hard to think about. And it's really sad to see that so many people don't care that people are going to die if Trump Care is passed, and it sucks.
I left Amgen in 2007 on their old folks get out type deal, and they gave us a package or whatever, but the insurance was 1 year. After that, I was really surprised I couldn't get insurance. I mean, without paying for about $3,000 a month, because I have actinic keratosis, pre-diabetes, and asthma. So nothing would touch, I couldn't get it. So I actually went without insurance from 2007 to 2015, at which time I was diagnosed with breast cancer. Along comes the ACA. I signed up, and I was able to get my operation. It would have cost me $120,000. And I'm low income. I didn't make any money. I've been living off my savings. So a lot of people are going to be very, very in trouble, and I'm quite worried.
So for me, I have a very specific outlook on this, because I was born in Dubai, United Arab Emirates, where you don't get any health care. Everything is privatized. They are living the American dream. You don't get citizenship when you're born there, and all of that. And we actually moved to Canada when I was 9 years old, so that we could be able to go to school, to public school, and to receive public health care from Canada. So I've experienced having health care provided by a country and having it absolutely not provided by a country. And I have to say that health care is a human right. It's a human right in any nation, especially a nation that touts to be free and touts to be leading the rest of the nations.
It's inhumane. You're taking Medicare and Medicaid away from people who depend on it, and you've got spokespeople for the Trump administration saying things like, why don't they go find a job that has, that offers health care, when, I'm going to have my 95-year-old mother who has Alzheimer's, in a home, go out and find a job and get health care for herself. I mean, this is inhumane.
It's worrying me that I would have to, if I had to go to Planned Parenthood to get some help or get some screening or see a gynecologist for any of my issues going on, that I won't be covered.
I have insurance now. That is fantastic. My fear is that if the ACA goes away, my rates are going to go up so high, and especially with union busting in our rearview mirror, I don't know what's going to happen in my future. I'm 61, and I've been fortunate enough to have good health for 61 years. But we all know, when your number comes, your number comes. I just don't know what is going to happen with us, and that's our reality. And if ACA goes away, I think America's screwed. I really do.
Eliminating the ACA, people have come to rely upon that. We need to expand upon it, develop it, instead of repealing it. That's what we need to do. That's what needs to take place. Or expand Medicaid. I mean, come on. We live in one of the wealthiest countries in the world. How come people aren't behind this? It's astounding to me. It really is. As an educator, as a mother, as a wife, daughter, I want to protect my own. I want to protect everybody. This is the way to do it. It's not eliminating Obamacare out of retaliation.
This earth doesn't belong to us. We're just here for a short amount of time. The whole thing is to make sure we can all benefit. We all have health care, especially the elderly and the disabled and children. And unfortunately, this president just doesn't understand them.